Disclaimer: this video is for educational purposes only. Hi, I'm Cornelia, anak Colin, a 4th year student from School of Physics, majoring in Medical Physics in University Science Malaysia. And what I'm about to tell you today is something interesting on ultrasound.
And there's your beautiful baby.
Oh wait, not this kind of ultrasound. Yes, this one. Have you ever heard about contrast enhanced ultrasound, or CEUS for short? No? Well, hop on and I'll tell you all about it. First of all, let's understand the basic principles of ultrasound. An ultrasound scan is a medical test that uses high-frequency sound waves to capture live images from the inside of your body. The technology is like the used by sonar and radar, which help the military detect planes and ships. But in this topic, we'll be focusing on medical ultrasound, which allows physicists to see issues with organs, vessels, and tissues without needing the surgery. Probably you're thinking why we need CEUS while we have the general ultrasound itself to diagnose issues within the body, especially kidney masses. Well, ultrasound waves are disrupted by air or gas. Therefore, ultrasound is not an ideal imaging technique for the air-filled bowel or organs obscured by the bowel, so in this case, the kidney. Thus, this is where CEUS plays a huge role in diagnostic of renal failure, where it also allows for dynamic and repeat examinations. CEUS is a modern application of ultrasound that uses contrast agents to traditional medical ultrasound. It's like the combination of ultrasound and contrast agents. So these two techniques create accurate detailed images for renal mass characterization.
The image is developed by waves of sound shooting through water into the womb and bouncing back, in much the same way that sonar is used to track a submarine.
So it all started way back in the 1960s, where scientists found that the injection of agitated saline caused a detectable signal change during ultrasound examination. This compressible gas core of saline bubbles enabling the bubble to backscatter the applied ultrasound, which leads to, you guessed it, contrast enhancement. However, those first saline bubbles were unstable due to the high surface tension. So nowadays, there are a lot of medical modern technologies where scientists invented more stable, commercially available, and FDA-approved ultrasound contrast agents, such as Albunex, an albumin-coated and air-filled microsphere to compensate the previous problem. So you're wondering how these thousands of microbubbles help to produce images en masse? So let's look into this one microbubble. It is encapsulated by a lipid shell with a gas-filled core. Once the saline or suspension prepared via the IV administration, the contrast agents are confined only in the intravascular space, and this can be viewed in real time, which gives its advantage. Then they oscillate as we move the transducer, which will generate harmonic signal. We apply specific contrast modes to pick up those nonlinear response signals to visualize blood flow in the microvasculature. Doctors often use CEUS instead of non-contrast ultrasound because it can show the difference between normal and diseased tissues. In the case of cancers and mass, this difference is primarily due to cancers having more blood flow. Cancers may appear brighter than normal tissue, or clear the blood faster than the surrounding. So using CEUS, this will create an image. To simplify what I just said, just imagine you're looking at a night sky full of stars shining. It's the same analogy to how we view the ultrasound imaging on the kidney using CEUS. Those thousands of microbubbles from the contrast agents reflect behind a dark background. This helps physicists and doctors to diagnose masses in the kidney. So, CEUS has a lot of advantages. First, it is safe to use, especially for patients with poor renal functions, because ultrasound is a non-ionizing radiation. Next is it is very easy to use with no prior lab testing. It's a good news for claustrophobic patients because there's no need to be in an enclosed space or loud noises. Next, it is generally more affordable compared to MRI and CT scans. And lastly, it is accurate to get a clear view of organs that don't show up in MRI and non-contrast ultrasound. However, everything has its cons. Microbubbles don't last very long in circulation. They have low circulation residence times because they either get taken by immune system cells or get taken up by the liver or spleen, even when they are coated with PEG. Ultrasound produces more heat as the frequency increases, so the ultrasonic frequency must be carefully monitored. Last but not least, using CEUS causes low targeted microbubble adhesion efficiency, which means a small fraction of injected microbubbles bind to the area of interest. So this is one of the main reasons that contrast-enhanced ultrasound remains in the preclinical development stages. So now you know what is CEUS and its principle. Even though the general ultrasound itself has been here for the past few decades, with the help of this new technology, it's a beneficial power-up for characterizing renal masses in the medical imaging department. Thus, this could improve patient care. Who knows, it can be a stepping stone to more high-tech medical apparatus in the future. I hope you enjoy my sharing today, and thank you.